But it's just that he has contempt for you, and he reckons that you should have just literal, actual death hanging over your head before you contribute to society.
Which side are you on? Which side are you on?
Medicaid expansion that's a perennial topic of conversation in Alabama politics. It heats up especially, it heats up at the beginning of every legislative session, but especially at the beginning of a quadrennium, which is when legislators feel the least heat from their constituents and, importantly, from lobby groups. It's why we're going to see a big school privatization push this session, because parents and teachers have the least recourse right now. But it is also why we will hopefully see a big push for Medicaid expansion this session, because the big lobby groups and the conservative AstroTurf organizations that oppose giving health care to Alabamians are going to have less leverage over those incumbents that might vote normally, if they just voted their conscience, they would vote to give their constituents health care, perhaps. But during an election cycle, those big lobby groups and conservative, just really anti-human organizations, right? I mean, if you're talking about not expanding Medicaid, that is just really an anti-human position, right? Because it results in the deaths of people. It results in the deaths of people, the economic devastation of communities, because it allows rural hospitals to close, and it cuts jobs. I mean, it's just really an anti-Alabamian position to be anti-Medicaid expansion. But so some of the ghouls in Montgomery, they're trying to preempt any conversation about expanding healthcare access in Alabama. And State Senator Chris Elliott, he is the one at the forefront. He is one of the folks at the forefront of this anti-Alabamian campaign last week on the Jeff Poor Show. He said explicitly that he opposes Medicaid expansion because he reckons that if people don't have literal death hanging over our heads, we won't work. He says, quote, "I'm adamantly opposed to expanding Medicaid. When we make it easier for people not to go to work, guess what they do? They don't go to work." And I mean, just think about that for just 2 seconds. Just one Mississippi, two Mississippi. Think about that. Who the hell is he talking about? I mean, this is even less believable than the people who reckon there are hordes of folks out there that are subsisting on food stamps just because. That are just happy to sit at home and collect food stamps, as if you can do that, as if you can just sit at home and collect food stamps and not work. It's even less believable than that, because who are the people out there that are refusing to work simply because they have access to health care?
It just doesn't make sense.
It doesn't make sense at all.
It's also wrong because that's not who Medicaid expansion is even targeting. Medicaid expansion targets low-income workers, right? It's people who are already working, but either cannot afford the private health insurance that is offered at their job, or their job doesn't provide any insurance, or they're working 2 or 3 part-time jobs and don't qualify for benefits. These are working people. These are people who are going to work. They are making money, but it's not enough money to qualify for subsidized Obamacare under the ACA, but it's too much money to get Medicaid as it currently exists in the state of Alabama. It's the coverage gap. And it's well over 200,000 people in that situation. Well over 100,000 Alabamians are offered private insurance but can't afford it.
Yeah.
Over 300,000 people would benefit from Medicaid expansion directly. Not the knock-on effects, not the family side effects of having...
the family side effects of your loved ones not dying.
Right. Turns out it's great to get treatment when you're ill.
God,
when you have injuries,
man.
It is great to get assistance.
Wow.
So, yeah, he's wrong. I mean, he's morally wrong, first of all. But, aside from that, his comments aren't even related to Medicaid expansion that's on the table. It has nothing to do with that.
Yeah. It's just, I mean, it is really just astounding.
Yeah, I mean, the thing is, I guess why let facts get in the way of tropes?
Right.
Because that's what he wants to traffic in, is tropes.
Right.
And he doesn't want to pay attention to the facts around Medicaid expansion, which would make it easier for people to go to work and easier to stay working. Because again, turns out when you're not dying, that's easier to go to work.
Yeah, it's easy.
When you break bones, it's better to get treatment. When you have illnesses, it's better to get treatment, and it's easier to go to work when you actually have health care.
Yeah. And I mean, Strom in the chat says, you know, do they not go to work in England where they have a national health service? Of course they go to work. Do they not go to work in Canada? Of course they go to work. Do able-bodied veterans not go to work even though they have VA health care? Of course able-bodied veterans go to work.
Right. Oh, and by the way, there are 13,000 veterans in the state of Alabama who, for various reasons, don't qualify for VA and can't afford private health insurance. They would get Medicaid under Medicaid expansion. So I guess Mr. State Senator Chris Elliott doesn't give a damn about those veterans.
Of course. Of course he doesn't.
You know, he's not interested in chiding the companies who aren't providing health insurance, which creates some of the demand for Medicaid expansion. He's not talking about them.
Right.
And this is a guy who is of a party that is all about economic development. Jobs, jobs, jobs. You remember that? There was literally a sign for Republicans that said jobs, jobs, jobs. I think that was...
There was one that said jobs, not mobs, too, was another one. And yeah, I mean, you know, you mentioned this in the notes, that it would be one of the most significant investments in rural Alabama's economic development in decades.
Right.
On par, you say, with the community college system and the Tennessee Valley Authority.
Yeah, I mean, I really do think if you look at the scale of the impact,
right,
and the ripple effects from that kind of investment, it would be on par with those two projects.
I mean, it would
change rural Alabama.
Yeah, create thousands of jobs in rural Alabama, allow rural hospitals to stay open, keep communities afloat, because really a lot of these communities in rural Alabama are anchored by the jobs that the hospitals provide.
Right. They have,
you know, in the same way that that they're anchored by the schools, or that in the past they were anchored by, you know, a Ford plant or a GM plant or something like that, right? Or the paper mill in Cortland. You know, I mean, places like that are now anchored by schools and hospitals. And so in addition to, you know, like you said, the knock-on effects of, you know, just the direct impacts of you not dying, and then the knock-on effects of your loved ones not having a loved one die, there's the economic impacts, which are massive. The jobs, the investment.
So much so that there's a lot of research to indicate that it would probably pay for itself. Now, the money, especially the upfront cost of expanding Medicaid is I know a big sticking point, but it's a very minor sum of money compared to the budget. There are many ways they could raise that money. They have been given many ways by many interest groups, by many citizens, many ideas on how they could raise the money. And that's assuming they end up having to really pay much out of pocket at all. And I think that's an assumption, because the economic development that would result, the additional tax revenues that would come from this, it makes it just one of the most sure bet economic development programs that Alabama politicians will ever get to pick from.
Right.
They don't treat it that way, but it is.
Exactly. That's and you know, so the takeaway here is that either this guy is lying or he just has contempt for you, right? I mean, because that's his main argument. It's contempt for Alabamians. It's not even that he doesn't even make the case, really, that it would cost too much. It wouldn't, of course, and like we said, it would create jobs and it would be good for the economy in the area. But it's just that he has contempt for you, and he reckons that you should have just literal, actual death hanging over your head before you contribute to society. And I pulled this clip from I was just going to do this segment, but then I actually listened to the segment where he was interviewed on the Jeff Poor Show, and I was like, I have to talk about this. I have to play this because I want you to actually hear his words, because he doesn't only want literal, actual death over your head. He wants it over your children's head, too. Let's listen to some of this from his appearance on the Jeff Poor Show.
It's reasonable to say you see a lot of the larger business folks and the hospitals in particular starting to put on the show about Medicaid expansion. The Public Research Council of Alabama starting to make its rounds about the benefits of Medicaid expansion and how important that is. I'm adamantly opposed to expanding Medicaid. I think it's going to be very expensive and put a huge burden on our budgets. But I think the underlying issue that nobody likes to talk about is it changes society. When we have more people on the dole that don't have to go to work in order to get health insurance, we end up wondering, why is our labor participation rate so low? And the answer is because in Alabama, half of all the children born in this state are born into Medicaid or CHIPS on the government dole. Half. And when we
All right, I got to stop it there just to point out half of Alabama's births are on Medicaid, okay? So he is resentful for that.
Yeah.
Rather than asking the question, why is it half of the people in the state I've been elected to represent, why is it half of the births are qualifying for Medicaid? Because he knows damn well Alabama is by no means New York or California. Right, Alabama is by no means the most, flexible or broad or liberal Medicaid program, even for pregnant mothers, even for teenage pregnant mothers. So why is it that mothers in our state are so poor that they qualify for Medicaid? That's not the question he's asking.
Right.
I'll continue.
Make it easier for people to not go to work. Guess what they do? They don't go to work. And that's my concern, is that our policies change society and the way families function overall.
Well, I tell you what, I hear that. I don't know anybody, at least on the Republican side of the aisle. Obviously, there's Democrats that are in favor of it, but no one's out in front of this one. And this is a big one. Maybe it does come up, but who is going in their right mind on the Republican side of the aisle is going to lead that charge?
Who in there, just stop that for just a second. Just who in their right mind on the Republican side of the aisle would dare vote to ensure that their constituents have health care? Right? Like, that's so removed from what Republicans want to do. Like, Jeff Poore has a problem even contemplating that. Like, what, there are Republicans that like care about poor people? No, I don't think so, Chris. I don't think so. That would be ridiculous. They couldn't be Republicans if they cared about poor people.
Yeah, and the other thing I got to say there, I have to go back for a second. I mean, about the half of births being covered by Medicaid. So would you propose they not be covered by Medicaid? I mean, is that really the logical conclusion here from Senator Chris Elliott, is that we shouldn't cover them at all?
Right.
So, I mean, what does that mean?
Yeah,
I mean, do you look back fondly on the Gilded Age? Do you look back fondly on an era before Medicaid and before any social services at all? I mean, maybe there'll be a rise in innovation from the churches and the poorhouses and the soup kitchens and the charities who are going to take the place.
Well, I think he's about to answer your question about does he wish that these children weren't covered?
That's right. He sure will.
I just know that I am starting to hear it more, and you and I've talked about this before. You start hearing these little conversations over here from Republican business leaders, and I just it's free money, there's nothing is free money, and again, there's a huge cost to society when you don't have to get out there and work to make sure your kids have health insurance. You don't have to get out there and work to make sure your children, you have coverage for your children to be born. It's a scary place to go. I think it undermines the fabric of our society. I've heard of employees that say, "Oh, I'm not getting married to my, to somebody I'd otherwise get married to because I can stay on this free state health insurance if I don't do that." That's a state policy that is bad for Alabama and bad for.
It's a scary place to go to ensure that regardless of income, mothers in Alabama can give birth. It's a scary place to go to ensure that regardless of their parents' income, the children will get the care they need. It undermines the fabric of society to ensure that children, babies, have health care regardless of their parents' income. I mean, like, how do you...
It's quite revealing.
It's really difficult to even... It's really genuinely difficult to even formulate an argument against somebody like that because, like, we just have such fundamentally different moral compasses. Like, I just reckon that... I reckon that even if your parent is one of these hypothetical, imaginary, no-good layabouts, that you should still have health care. If you're a child, even if your parent is a no-good layabout, you should have health care. And I don't know how to argue that point to people like this. Like, I don't know how I convince somebody that doesn't think that should be the case. I mean, it's just, we just have totally, just vastly, and I think that my opinion is in line with even the majority, the super majority of Alabamians who are, the voting Alabama. I mean, of course, most registered Alabamians don't vote, and then most of them don't vote for Republicans. I think it's only something like 26% of the eligible voting population votes for Republicans. So, but I think even among that group, I am with the majority of people that say that regardless of parental income, your children should have health care. Like, I just don't think that's a radical position, but somebody like him who is so far on the other side of this issue, who says that actually your children's health should be used as a cudgel against you to make you go to work. I mean, I just can't imagine, I can't get my head around this guy's morality.
Well, I think he said a lot by bringing in fabric of society, because what he's saying is that for him, the fabric of society is quilted through punishment, through leverage, through precarity, that the well-being not just of yourself, but your actual children is dependent on you going out, participating in the marketplace, hoping it goes well enough for you. Because the alternative that this guy proposes is punishment. Yeah. Punishment for children, punishment for babies, punishment for the elderly, for spouses. It's a level of cruelty that is just, it's hard for us to imagine because we have basic empathy, man. Yeah. I mean, we don't want children to go sick.
Even if their parents are layabouts. Like, I
don't care what a parent is.
I think that the number of people who would actually fall into that, or just like genuinely like immoral, lazy layabouts, I think that the number of people that exist like that are vanishingly small, but I think even if they have children, their children should have health care.
Right. Like, I don't care if that person is the worst person on earth.
Yes. A literal murderer.
If there's a child, the child deserves health care. Just like they deserve a safe, healthy life and a good education and a safe home. It's really, and the thing that will piss me off more than anything, and I have intentionally not looked it up because of this, but I would bet you money that State Senator Chris Elliott describes himself as pro-life. I bet he's real pro-life. He's so pro-life that he thinks it's okay to punish children. Deny children health care because of what their parents may or may not do.
Yeah. It's just it's bizarre. I can't understand.
It makes me sick. It really makes me sick to think that a person with this mentality has any position of authority over other human beings. Yeah. What kind of mentality does this guy have when he sits down every year for the budget and when he reviews legislation? Yeah. Think he gives a damn about any of us?
No. You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.